What I think I want to do now is I want to try and stitch in the technicalities of TOV, what it's about, how it's working, into how IFA as an organisation is communicating in particular with stakeholders. This work is very advanced at this stage. We've been doing it for 2 years now, and of course we're approaching effectively what is D-Day, probably the 30th of June. So I just want to take you through where we've come from, the background to it, and where we're going. And just to say to you as well that most of what we were doing is very much informed by what's happening in Europe. So Ireland is not just standing alone. We're following the lead from Europe, but we're putting our own twist on it, very much so. So, just to go over basically why the TOV initiative from a communications perspective. It's basically about additional levels of transparency concerning what our industry does with healthcare professionals. And obviously, additional levels of transparency are always, I think, a positive thing. Secondly, it's about underpinning the standards of integrity that is expected of us among our stakeholders. And thirdly, I think, and very importantly, this is a great opportunity for the industry to demonstrate the importance of TOV to improving patient outcomes. And I don't think we should ever feel shy in standing back from that. I think it is a great opportunity if we can communicate it correctly. Now, the communication objectives basically are threefold, and they very much fit into what you've already heard this morning. Building awareness and support timelines, what TOV is about, talking to our stakeholders. Rebecca and myself in particular, and Oliver O'Connor and other staff in the office have been heavily involved in this for 2 years, and we continue to do it. Managing reputation, a huge element, because there are aspects of this, especially from a media perspective, that could be interpreted in a particular way, and we have to be ready. But it'll be down to individual companies, obviously, to be able to address issues to do with their companies. We can address it in a general way, but reputation is very important. And the great consent word that you've heard so much this morning, at all times in all our communications, and especially to the medical organisations, we are pushing the fact that we need to get the highest levels of consent, which are relatively healthy at the moment, as Rebecca's mentioned, something around 60%, but we want to keep them up and keep them as high as possible, because that will underpin the message of transparency. Now, there are certain challenges that we may or may not face. We're not really facing them yet, but there are just a few things that I would see. The whole TOV thing about pharma giving money to doctors, it can feed into negative perceptions about pharma, which unfortunately we all know are there. Could lead at times, and I think when we get to the 30th in particular, close media scrutiny. And again, a lot of the media are driven by particular fixed agendas when it comes to pharma. If our consent levels are low, and we're hoping that doesn't happen, that will dilute the transparency message. That's why we have to keep pushing right up until the 30th to keep them up. TOV, if it shows extensive support for HCOs, that could lead to a certain degree of negativity on the health services and the HSE. Why is pharma having to step in? Why can't the state do this? And a certain risk of our relationship damage with individual stakeholders, with individual doctors and organisations. But I think we are mitigating that because we're working so very closely with them. On media scrutiny, that we're not expecting that to become really intense until closer to the time, and that is the experience across Europe as well. On our communication strategy generally and the stakeholder outreach, a lot of you will be aware of this already, but this is a range of the organisations that we're working very closely with, and we continue. You'll see almost every major medical representative organisation there. The Royal Colleges of Physicians, Surgeons, the Medical Council itself as the regulator, the Pharmaceutical Society, the HPRA, the HSE as well, that we're conducting a special training course with next week. So we are working closely with them, and we are pushing the consent message and the importance of this, communicating to their members. Now, how are we actually doing it? What are we doing besides meetings? Just to take you quickly through this, we have bespoke communications material that you all should be aware of and we have available. We're contributing to member journals and publications. We've got a lot of stuff into those. We're speaking at conferences. Both Rebecca and myself have been speaking at conferences. Direct advertising in the medical press. We had a major ad there a couple of weeks ago. Alignment on messaging with FBIA and sharing it with stakeholders. There's very developed messaging and Q&A material now available, which has been distributed through your chief reps. If you don't have it, contact me and I'll send it to you directly. But we're also sharing this with our stakeholders to ensure that they are aligned on the messaging as well. We're holding a special workshop for the communication managers in the HSE throughout the country next month, and I think that'll be a great opportunity again to align on messaging. We have a section on our website. We've been using social media and also media outreach. Just to take you through the branded communications material, you should be aware of this already, but it's on our website and you can get it directly from us. An example of what we've got into the medical journals, the IMO, ICGP, Irish Hospital Consultants, the Medical Council. Just last week, Oliver O'Connor had this in the Irish Hospital Consultants Association journal. Again, a very extensive positive article pushing the whole consent message, going to our target audience, which is obviously our primary target audience being the consultants. This is the ad we had in the Irish Medical Times about 3 weeks ago. Very positive feedback on that, and very happy to say that FBIA picked up on it and are using it as best practice of what to do to advertise directly to the medical press. Again, the message there linking transparency to consent and appealing directly to doctors on that. Our website, social media, again, I've been using a lot from Twitter in particular, informed by FP. You can see that on our website, and I think, again, that's been responded to well. Key messaging alignment. Well, there's an awful lot of messaging, and you know, when you look at it, you'll see there's a lot, but we can break it down to 5 main areas, I think. That collaboration between the industry and doctors benefits patients. Collaboration, a range of activities. It's about exchanging information on how new medicines fit into the patient pathway. Thirdly, it's already a very well regulated area, but greater transparency will strengthen this collaboration in the future. And society itself across every level, as we all know, has greater expectations about transparency. So let's bring more transparency to every aspect of healthcare. And lastly, you know, we want to work with all our partners and stakeholders on this HCP model and message and push it at all levels so they all understand the relationship. Now, the media, to come to it, what have we been doing with the media? There would be a view among some people, you just go right out there and you talk about how great HCP is. We need to be very cautious about this. And I think the media themselves have shown some degree of interest. We have been working with them in a gradual way. We spoke with Paul Cullen in the Irish Times, who put a factual piece in. This is from the Irish Medical Times, Irish Medical News, Sunday Business Post. Our consent levels at that stage were up at 70%. We've dropped back a little bit, but we've been briefing individual journalists, but all of them are saying, yeah, come back to us on the 30th. And that's what we kind of have to expect, and that's what's happening across Europe. But we are working with them to inform them. Now, what we're going to be doing closer to the time, and essentially it's going to be about protecting the reputation of the industry as much as we can, and we can only do it from the perspective of the industry. Individual companies have to do it themselves if there are queries directly to them. We'll continue our individual media briefings. We will have a media briefing in here, I would imagine, probably the 30th, if that's the day we go with, and it looks like we're going live that day. And obviously we'll have a widely pushed press release across all channels and social media, you know, and we'll have the health media and as much of the general media as possible in here. We will continue to work on our key messaging and Q&A material that we can use now for reactive statements and that I can share with any of you. Very importantly, we're going to try to use real-life examples of TOV to HCOs in particular. And I would appeal to any of you, if you could get through your companies, examples of TOV in action to hospitals, to organisations, how it's really benefiting people that I can use for communications purposes, will really be very good to work with journalists. But I need to get that, and we're putting that together. And obviously, post the disclosure period, and again working with FPA, we will be monitoring the media very, very closely and responding as appropriate to negativity and helping you to work with you if there are particular issues, journalists after, particular payments or whatever. Just to leave you with 3 points, I think, which hopefully sum up from a communications perspective where TOV is coming from. The interactions are profound and positive influence on the quality of patient treatment and the value of future research. The greater level of transparency is designed to assure the public that they can trust their doctor to recommend treatment or administer appropriate care based solely on clinical evidence. And lastly, it's a fantastic opportunity for the industry to demonstrate that TOV plays a major role in better healthcare delivery. So that's my presentation. I'd be happy to take any questions now if you'd like. Everybody happy?
One question. Can we get a copy of the slides afterwards?
Certainly, yes.
All slides from today, all the presentations from today will be circulated to all attendees, okay? Amy will just take her a moment to sort of, if you have provided, if she obviously has your details, please also make sure that you've signed in.
And not only can we provide the slides, we're recording this, so we'll be able to get that to each of you as well, which I think will be very useful because there's, other than my own, there's been some great stuff here today, so absolutely.
That's the second question then.
Yeah.
Are you aware of any companies that might be thinking of going directly to some of the journalists you've mentioned in advance?
Well, there's the odd bit of skirmishing going by individual journalists. I mean, Susan Mitchell in particular, who is always digging around for stuff, but it's never come to anything. But through the Communications Advisory Forum that I chair, that has all the comms people on it, we stay in touch on that. There's been individual queries, but it doesn't seem to have gone anywhere. And this is generally the experience across Europe, because I sit on the FPA communications group as well. And there's been some interest, but again, it's a story we want to see. We want to see the colour of your money, at the end of the day.
Is there any proactive activity on behalf of companies, though, to want to talk to the journalists in advance on a company-specific basis?
It's certainly something we're not recommending, and I'm not aware of any of it. I think it's fraught with danger.
Just on that note, Susan Mitchell has done a freedom of information for some of the major hospitals, looking at not only research-based pharmaceutical companies, but interestingly generic companies and medical device companies. So it could be a much more interesting story than we realise. Obviously, I don't know what results she's got from that.
You see, when the queries start to come in from particular journalists, if they say Dr. A and such got a payment or whatever, they're going to obviously the doctors as well, which is why we've been working with the ICGP and the IMO in sharing messaging as well, and the Irish Hospital Consultants Association, and they've been grateful of that. So we've provided them at least with messaging that they can give to the doctors to say, well, this is why I went to that conference, because it's about making me a better medic and educating me and such and stuff like that, But it does have the potential to be tricky in particular areas, because there's a lot of TOVs across a lot of areas. Yes.
I'm just wondering, some companies possibly wouldn't have representation on your comms group. If there's another distribution list that could receive information about the press releases that you're sending out, just so that we're forewarned as well? Yeah,
well, everything that I send out goes to the chief reps and is supposed to be cascaded down. I sent out there very recently a whole load of key messaging material. So that should come to you certainly. That's the way stuff goes. Yeah.
I have a question in relation to I suppose writing to healthcare professionals and healthcare organisations, and maybe yourself or people in the room might be able to answer. But do you know, have companies started to do that yet? And if so, has that affected their level of consent? Because what we intend to do is just send out a statement as such. This is what it is.
Well, this is what we recommended as best practice there a number of weeks ago, and certainly to do it that way, just to say, are you aware of this? And you signed this contract or such and such, and we would. I think it's about building future relationships with them as well. if it causes some of them maybe to withdraw consent, obviously we don't want that. But I think it's better rather than if they've forgotten about it.
Yeah, I suppose I'm just inquiring because we'll be sending out our letters shortly, but I just want to know whether I should anticipate a huge influx of calls or changes in consent, or has anyone else started to?
I'll ask you, would you say, can you reply?
I sent mine out early April. I've probably had 10 queries back out of 500 letters went.
Okay.
And I only had about
Anybody
10,
withdrawing consent?
which about 5 were withdrawing consent,
Yeah.
and 5 were just querying the
Yeah,
consent.
well, that's a pretty good statistic.
Thank you.
That's good, yeah. So hopefully that answers that so far, yeah.
We would have sent out communication to any HCP or HCO that received a TOV in March. We also contact anyone that received a TOV over €1,000 directly, in person, face to face, or over the phone. And so those conversations may have led to some people withdrawing consent because maybe the letters fell on their tables but they didn't open them,
Yeah.
or emails didn't get through.
Yeah.
And we had some really good conversations
Mm.
and some very positive ones, and then others where
Mm.
people just said they wanted to withdraw.
Mm. Yeah, as I said to you, I think the key thing emerging from this is it's the opportunity for the industry, you know, to get out there. This is something that's been happening for years, but it's an essential part of the healthcare system and the development of new medicines, you know, and it's, you know, let's get out and communicate this, why this relationship with doctors is so important. And this is a new level of transparency that we as an industry have initiated. So, you know, let's get out there and communicate it. But individual and malicious journalists will do what they want to do with it, but hopefully we'll be ready for that and be able to defend it as much as we can.